Hi, I'm Mike Stoltz, the CEO of the Association for Mental Health and Wellness. This is one of a series of videos that we're doing during National Mental Health Awareness Week to tell you about recovery stories and challenges and new resources in the community. Unfortunately, sometimes when people are experiencing serious distress, they need to call 911 and recruit the assistance of law enforcement. Fortunately, in Suffolk County today, our county has decided to adopt a model of training for our officers to be able to respond as sympathetically and compassionately as possible to people who are experiencing mental health challenges. And here to tell you about it is Officer Ray Sitler of the Suffolk County PD and the coordinator of the Crisis Intervention Team Training. Ray, can you tell everybody a little bit about C.I.T. training?
C.I.T. is Crisis Intervention Team. That's what our team is called. It's a training that officers receive 40 hours of additional mental health training. They learn about co-occurring disorders such as substance abuse, the signs and symptoms of mental health issues, the stressors in their lives that can bring on a crisis, different ways of communicating more empathetically, and providing more outlets for the consumers to have, locations where they can get assistance, having more of a knowledge of that.
So some of the resources too?
Yes.
So what would you hope to be, you started a little bit about that, what are some of the skills that our public and people with mental health challenges might be able to see that officers gain because of their participation in C.I.T. training? What are some of those kind of skills?
The biggest skill that we pick up is the communication part, the listening, understanding what the person would like to happen to themselves, which also empowers them to, if they have some part of the decision as to what is going to happen to them. It's very empowering to them, which is something that they need to have. So it's listening is the big thing, and doing that communication. So you take anything out of the training, listening is it.
So I'm going to ask you a question that we didn't prepare for, but what's been the response by officers to this training?
Days after training, I can't believe it worked.
Really?
Yes. I've had communications back is, I cannot believe what you told me worked the way it worked.
That's really encouraging.
Just like I was in class.
That's great. That's great. So what would you hope to be the outcome of the training for officers? How would you hope they might respond differently?
That their phrases are more empathetic towards people, their contact with them, they are able to transfer more information to them about what is available in the community, the resources that are out there.
Excellent. That's excellent. So right now you said you just started this, and the objective is that you're training 40 officers. Is there a hope that you might be able to train more?
Right now we have 72 officers that are trained.
Excellent.
In Suffolk County. We started in January, getting ourselves trained as instructors in the program, following the model of the Memphis model for crisis intervention team training.
And so this is really, this kind of training helps not only to respond properly to people and families who experience mental health distress, but it also helps in terms of safety of the officer.
Yes,
right?
If we can handle a call and not have to go hands-on, as they would say, it's better for the client or the consumer, it's better for the officer, less injuries, a better outcome, and the next time that we might possibly need to be called, it'll have a better result, because both parties will remember the way the situation was handled, and they get along a lot better.
Well, we really appreciate your taking the leadership on helping to eradicate stigma, and a big way for that is to be able to have law enforcement to be able to be in a compassionate, responsive role. So thank you very much for telling everybody about that.
It's a team effort. It's the consumers, it's the clinicians, the providers that are out there that are helping them, and the officers. It's a team effort, and that's what C.I.T. is.
Thank you very much for educating our audience today about this great initiative on the part of Suffolk County PD.
Thank you.